Okay, I'm going to show you how to do a Travell trigger point release now on subclavius. Subclavius is the tiny little muscle that runs along the clavicle underneath the clavicle and attaches to the first rib. So its action is to help elevate the first rib in inhalation, but it also helps assist the clavicle in moving anteriorly and inferiorly. So when this muscle has a trigger point in it or is affected, it can cause some problems with breathing. It can reduce range of motion in the clavicle, so the SC and AC joint may be immobilized, and you may see some pain in the shoulder as well. It might be one of those muscles that's an accessory muscle to shoulder issues, so somebody's had frozen shoulder or decreased range of motion for whatever reason in the shoulder, or is working through a shoulder injury. This is one of those muscles you may want to take a look at as well. So in order to palpate it, I start at the acromion and work my way down the lateral part of the clavicle here. And in this section here, kind of in the lateral third, it's easier to dip underneath the clavicle a little bit. It's going to depend how tight their pecs are. Maybe you can go a little bit more medially and tuck underneath, but I find it's easiest to palpate sort of at the lateral third. So again, you're going to have to sink deeply into the tissues by getting the person to take some slow, deep breaths. And let your fingers tuck in and under. And become aware on their inhale if you feel tissues kind of coming up into your thumbs or your fingers. So that's probably subclavius if you're tucked underneath enough. So I'm going to pretend that we have a trigger point here. So Paige, is it tender?
Oh yeah.
We actually might have a trigger point here. On a pain scale of 0 to 10, 0 being no pain at all, and 10 like putting your hand on a hot burner, where would you place this on the pain scale?
5.
And does it radiate?
Yep.
Where does it go?
Out to the anterior aspect of the shoulder.
There we go. So we found one. Yay, it's our lucky day. And if you weren't sure and you wanted to make sure, you could get them to take a deep breath in, or you could get them to press up into your hand. So press up into my hand anteriorly. Good, and relax. Did that make it a little worse?
Yep.
Yeah, I'm hurting Paige today. I'm so sorry, Paige. You're so nice for helping me. All right, so take some deep breaths here. I'm going to maintain a compression, a static compression. And we're slowly going to help her relax and let that release. It's at a 5. If it was really, really painful, let's say it was at a 7, what I could do is just release a little bit of my pressure to get it down to a 6. Remember, we don't like to go really above a 6 with these trigger points. But again, it's subjective. Pain is subjective. So work with the person. If they're able to relax and breathe through it, then it's probably okay. But remember, shortest, gentlest, mildest is always the most effective. So I'm just maintaining this compression. I haven't changed. Be aware of not changing or altering your pressure with Travell trigger point release. You want to maintain a static pressure. That will give you the correct feedback when you ask them again about what the pain scale is and whether or not it's changed. So is this releasing it all, Paige?
Yep.
And where would you put this on the pain scale now?
Down to a 1.
1, good. So 1 or 0 is your cue that you can release that. And let go, and then flush the area out. So you can do some massage here, maybe with your palm going up and away. If you have somebody who this is one of the muscles, just like the ones I'm about to show you with pec major and minor, that if somebody has larger breasts or larger chest, you can get them into side lying, and you can also access the subclavius in side lying, which also takes the breast tissue out of the way, but also puts it on a little bit of a slack because you can draw the scapula forward, which moves the clavicle forward as well, and you can tuck underneath a little bit easier. So just think about that. There's lots of different ways to treat these muscles. So make sure you think about changing your client's position in order to accommodate their particular anatomy and make it the least invasive for them as possible. Okay.